Nearly all of us eat too much salt, or sodium. As a matter of fact, the average American consumes over 7 grams of sodium per day, and we really only need about 2 grams. The more salt we eat, the higher our blood pressure will be. And for the most part, salt comes from processed foods, not necessarily from the salt shaker. Eating less salt is an important way to reduce the risk of high blood pressure, which may in turn reduce your risk of heart disease, stroke, congestive heart failure, and kidney damage. Other lifestyle changes may also prevent getting high blood pressure. These include eating foods rich in potassium, losing excess body weight, being more physically active, and eating an overall healthy diet. A diet rich in potassium helps counterbalance some of the sodium's harmful effects on blood pressure. You should consult with your doctor for advice on how much sodium and potassium you should get, but in general, older adults should aim for about 1,500 milligrams, which is only 60% of the recommended daily value for sodium, and should also meet the potassium recommendation, which is 4,700 milligrams, by eating potassium-rich foods. When choosing packaged foods, check the sodium content on the nutrition facts label. Potassium-containing foods include leafy greens such as spinach and collards, bananas, and fruit from vines such as grapes and blackberries, root vegetables such as carrots and potatoes, and citrus fruit such as oranges and grapefruit. When choosing packaged foods, look at the sodium content on the nutrition facts label. Use the percent daily value to limit your sodium intake. 5% daily value or less is considered low, and 20% or greater is considered high. You don't want to exceed the total of 100% daily value for sodium in a day. Some people with high blood pressure, African Americans, and people middle-aged or older should get even less, about half as much. Compare sodium content for similar foods. This can really make a difference. By comparing brands of similar foods, you can save over 100 milligrams of sodium. Use the nutrition facts label on the package to select the food brands that are lower in sodium. Use the claims on the front of the package to quickly identify foods that contain less salt and are a good source of potassium, a nutrient you may want to get more of in your diet. Examples include low in sodium, very low in sodium, and high in potassium. When you're preparing food at home, use herbs and spices to add flavor to your foods so you don't depend too heavily on salt. Don't salt foods before cooking, and limit the use of salt at the table. When you're eating out, ask that your meal be prepared without added salt, or ask the server to identify foods on the menu that are available without extra salt. To achieve a desirable blood pressure, you should limit your sodium intake to no more than 2,400 milligrams per day. If you have high blood pressure or heart failure, you should go down to 1,500 to 2,000 milligrams per day. Also limit alcohol consumption to no more than 1 drink per day for women and 2 drinks a day for men. And maintain a healthy body weight and dietary pattern that emphasizes fruits and vegetables and low-fat and fat-free dairy products. As far as sodium guidelines, use fresh ingredients in foods with no added salt. For favorite recipes, you may need to use other ingredients and delete or decrease the salt added. Salt can be removed from any recipe except those containing yeast. Try orange or pineapple juice as a base for meat marinades. Avoid convenience foods such as canned soups, entrees, vegetables, pasta and mixed rices, frozen dinners, instant cereal and puddings, and gravy sauce mixes. Select frozen entrees that contain 600 milligrams or less of sodium. However, limit to 1 of the frozen entrees per day. Check the nutrition facts label on the package for the sodium content. Use fresh, frozen, no added salt, canned vegetables, or canned vegetables that have been rinsed before they are prepared. Low sodium canned soups may be used. Avoid mixed seasonings and spices blends that include salt, such as garlic salt. So who should be on a sodium-restricted diet? People with high blood pressure who are sodium sensitive. Not everybody is sensitive to salt, but if you have high blood pressure, if you have congestive heart failure, or people who need to lose weight, you may benefit from a sodium-restricted diet. And what can it do? It can help normalize your blood pressure, and it can also help manage your fluid retention. The advantages: blood pressure can be normalized, and you may be able to eliminate or reduce the dose of blood pressure medications, and may also promote weight loss. The disadvantage to a sodium-restricted diet is it may eliminate processed foods that you enjoy, and dining out may be more difficult for you.